Okay.
Okay, you are talking to Miss Muna,
Mm,
who's the mother of Ali. Ali is 10
mm.
months of age,
10 months.
presenting in 10th 10 month, yeah, of age,
Mm,
presented in the ER with broken right arm, and it is his third fracture in his life. It is the
mm.
third time he had this fracture. So now
Mm.
you have to take the history from the mother. Okay?
And my assessment is,
No, it is history case, not assessment.
so history. So I have not prepared now. Okay, I take the history.
Take the history.
Mm. Okay, then taking the history.
Okay, I'm
Hello, good
starting the.
morning, Mona.
Good morning.
I'm Dr. Emma, one of the children doctor in this hospital. I believe I'm talking with Mona, mother of Ali.
Yes, I am. I'm on, doctor. Thank you for being here.
Today I'm here to talk to you about Ali's health condition and writing some note. Is that okay with you?
Yes, doctor. You're most welcome.
Thank you. Can you please tell me what is your main concern to come here?
See, doctor, I don't know really. I have been busy in my work. I don't know why this is happening again and again, but this time again, my daughter, she's turned 12 year of age. She covered me that mama, that Ali has fell down, he has broken his arm. So I immediately rushed and I just brought it directly to the in the here in your ER. So I don't know
Hmm.
really any background.
Okay, understand that. So that is her right arm is broken. This is the third time occur. Am I right?
Yeah, doctor.
And before anything you don't know, anything tell your child.
Actually, see, I could not blame my own daughter because she is favoring me because based on her, I am able to work at my office.
Hmm.
So she is, although she's sometimes busy in maybe in her mobile, she's watching some game. Maybe sometimes Ali may fell down. I have no really idea.
Okay, I understand. Really understand that. So after brought her here, what doctor do? Any plaster, anything they do?
Yeah, previously, every time the same thing. The doctor just made the casting.
Hmm. Okay. So do you have any other concern beside these fractures?
No, doctor, this is the only the fracture. If you think it is the only the my main concern, why this is happening again and again.
Is that Ali suffering any chronic condition, anything?
No, this is the only fracture. If you notice, if you say it's chronic condition, then it is the chronic condition.
Okay, I'm sorry hearing that. So is that Ali have any fever?
No,
What about weight? Any weight change occur recently?
really, doctor, I am been in the office and I have no time really. When I came, I was so much tired. I go into my room and just sleep. My daughter is the one, and I cannot blame her that we are not, we don't know the weight. Even I
Okay,
have no time to just her, look him very well.
okay. How about the activity? Do you any activity recently change any activity?
My daughter didn't mention anything.
What about sleep? Have you any idea about the sleep of Ali?
Really, I have no idea.
Okay. So I'm going to other parts. Like first, is there any head change occur her?
Mm, it seems to be a little bit big head, but I think maybe it is normal. I didn't notice. Maybe like head a little bit big.
Okay. Any abnormal movement, feet, anything?
No,
What about Alice visions? Any change in vision?
he's 10-month-old child. How he can tell about his vision? I don't know.
Any change of eye color, like blue eye color, anything?
No, no, doctor. I didn't notice.
What about Alice hearing? Any problem in hearing?
What he is while he is being playing, I didn't notice anything while he's easily listening to. I think when my daughter is just making him her some instruction, he is listening well.
Okay. And to ask about any heart racing when you hand over her racing heartbeat. Anything you
Really,
feel?
really very sorry. I don't know.
And is that any repeated chest bug? Anything?
No, doctor, I have no idea. No, doctor, I think no. This I don't think so.
Okay. So what about, and to know that uh, any tummy pain,
I know.
any tummy distensions?
He looks a little bit distended, but I think it is normal. Like his body is maybe it is normal for him.
Okay. Any pee problem?
No,
Any poo problem?
no.
Okay. So about her joints, any Ali has any joint pain? Anything?
Just I noticed there is some swelling in his wrist area. Also, this his foot area also a little bit swollen.
And about it, his chest, anything bone change? Anything notice?
Uh, Maybe there is, but I didn't really because I am very busy in my because I'm a single mother, doctor. I have no time to look after him. So maybe there is. So I didn't notice it.
Okay. And is there any notice any the leg bone bowing like that is change occur, any deviation occur in the leg bone?
Mm, Not really. I didn't notice anything. 6 minutes. No, four
Okay.
minutes remaining.
Any 6, not 9 minutes, 4 minutes. It is history. It's not development.
Yeah, 4 minutes
Okay.
remaining. Yes.
9 minutes, 4 minutes. 13 minutes is history time. It's not development. Now I to ask you. You tell me it is history.
So
Okay.
so history.
Is
No,
there any
this so
skin?
6 plus 3 or 6 plus 4.
9 plus 3.
Nine
History
nine.
plus 3.
No, no.
Give me
9 plus. Okay, okay, okay. Then okay.
9 plus 4.
Oh,
Sorry, 9 plus 4, not 9 plus 3.
okay. Oh
Okay.
yes. Okay.
Then
9.
give me
Mm.
extra 1 minute. Give me. Is there any rash in his body?
No.
And what about any hot or cold intolerance? Anything?
Only diaper rash. It is there. Only that is. I didn't. I just noticed one day my daughter was telling me, Mama, see there is so much rashes on the diaper. So I said, why not keep changing the diaper? But later on I realized because I am really difficult to buy because it is now very heavy, expensive pamper. So I cannot blame her, my daughter.
Okay, understand. I'm sorry about that. So, okay. So, any hot or cold intolerance? Anything?
No, doctor, this is 10 months of age child. How could I know?
Okay, okay. Trying to ask about the past history. So, is there any admission before he needed?
He came only because of this casting, because of
Okay.
fracture.
So, last when the fracture occurred?
Doctor, really, I am not sure, but maybe 4 months before, maybe.
Is there any trauma? Anything happened before this type fracture?
Doctor, actually, I'm not being in the home mostly, so maybe he fell down several. I have no idea in home if he fell down.
I understand that. Recent any traveling history?
No, doctor, I cannot afford with my
Any
children.
any blood transfusions?
No,
Okay. Any surgery previously?
that is the casting only. If you say it is surgery.
Hmm, I can understand that. So, how is Ali's diet? Can you please describe me what food he is taking?
He is actually, I just he's still on breastfeeding. I'm just giving him my express by milk and put in the refrigerator. That is
Mm.
I'm doing because I cannot afford the expensive milk to buy from outside.
So, only breast milk. Is there any weaning like vegetables, rice? These are giving? No, only
No,
breastfeeding.
yes, yeah. I'm very careful mother. I'm still giving her exclusive breastfeeding only. That's it.
Okay, okay, I understand about that. So, I want to ask about the birth history. When Ali was in your tummy, Is that it was smooth journey or any event, anything you want to tell me?
Actually, doctor, I don't really want him. I tried to abort him. I have,
Hmm.
even though I taken the pills, but unfortunately it is not working. So he
Okay.
came into this world.
Hmm. So after birth, is there any admission
Nine
needed?
minutes, okay.
Any admission
No,
needed?
I don't remember anything. Yeah, no, nothing such like that.
Okay, now 4 minutes, remember. Okay, so what
Hmm.
about that vaccination? He has taken all the shot according to age.
Yeah, I think so. I think so. If somebody coming, I told my daughter, if somebody coming at door, give the vaccine.
Okay. And is that Ali an allergy to any substance?
I don't think so.
Okay. And what about his growing, like when talking, running, speaking? Is everything according to 10-month age old?
I think it is okay.
I mean, he can hold and stand, pull to stand, 10-month old.
Yeah, doctor.
Okay. And okay, so I have to ask some about your family history. Um,
Mm.
can you please describe your family?
I'm a single mother
Hmm.
and living with my 12-year daughter who's taking care of Ali.
Hmm.
I That's it.
Okay. And what about Ali's father?
He's not in the picture. I really don't want to see him again.
Okay, okay. So what about when you go job? Who care Ali?
My daughter is the one who is taking care.
How many children you have?
This is this too, doctor. I told you. One is Ali, one is my daughter.
Understand. Is there any family history of any fracture, anything like that, similar condition?
Not in my family. I bought his dad. I don't. His dad. I don't know.
Can you describe your home?
I'm living. I have a two-room apartment. One room is for me. One for my childrens, and they are living with their kittens.
Okay. So is that well radiated, ventilated, sunlight comes in your home?
No,
This
doctor.
type
Actually,
of.
I cannot afford this luxurious home. I This is my closed apartment. And it is not very well ventilated. Even some light is also not very good there.
Okay. So what do you do for living?
I'm working in a uh, cruiser where I am traveling a lot. I'm working 4 days a week. So in 4 days I am not been in home. So my daughter is the one who's taking care of him. So once I came home, I already been very tired. So I just directly to my room and just I sleep. Then my daughter is the one who is taking care of everything.
Okay, I understand that. So is that your income is satisfying you?
No, doctor, it is not. My income is also not satisfactory.
Okay. And is there any emergency access to go?
Yeah, doctor, when there is needed, we can call the ambulance.
Any social services involved in your family or taking any help?
No, doctor, still not now.
Okay, okay, I understand. And how this disease impact you?
Really difficult to see him while having him this repeated fracture. But what I can
Okay,
do, I have to do with my job. All things I cannot handle all things together.
you completely understand. I am with you. I
13 minutes
understand that.
finish. I'm giving you extra time. Okay, complete.
Oh, 1 minute not needed, I think. Are you already done?
Okay, okay, start. The present.
So today I get the opportunity to take history for Mona. Mona is a mother of Ali. Ali is a 10-month-old child who comes with the chief complaints is the fracture of the right arm, and this is his third time of the fractures. So before what
Mm-hmm.
happened, actually, mother can't explain that he was on work, so doesn't know. And a 6-year-old girl, her elder daughter, take care her. And history, actually, I find this is third time, and the physics, the child has some frontal bossing, big head telling, and there is diaper rash The
Mm-hmm.
important is the family history. The child is taking only breast milk though, 10 months, no weaning given. Vaccine, actually the child, when the home visitor go, the elder child take the responsible, so mother doesn't know. About home, actually, the home is not big and there is no proper sunlight is not there. Mother is telling. So putting together, it is a case of on fast top diagnosis, fracture case. So first we can choose rickets. Second, non-accidental injury or child abuse. Third, we can keep what we can keep osteogenesis imperfecta. I ask in rickets actually the features. First of all,
Mm-hmm.
nutritional problem. Second, family home is not well aerated. These are also
Mm-hmm.
the some features I find like frontal bushing and repeated
Mm-hmm.
fracture. And
Okay.
non-accidental or child abuse it can be because mother very busy and she does not want to the child want to abortions. She's a single mother, very much disturbs. So
Mm-hmm.
that's why. And the third, osteogenesis imperfecta, I don't get any fracture, but there is repeated fracture feature I find. But eye, blue eye not present, no hearing problem present. So rickets on my
So,
top.
how would you proceed?
So after taking my history, I'll revise my note. I will examine him. I will examine him from head to toe. General examination I will do. ABC vitals I will do. Heart rate, respiratory, everything. Child stable or not. And I will musculoskeletal examination I will do, and I will
Mm-hmm.
actually, is there any bruises, any mark, bite mark, anything, any
Mm-hmm.
injury mark? If I find, I will take the photograph, and
Mm-hmm.
I will about their age. I will mentions every documents I will do. I will look at the caregiver, the mother and the
Mm-hmm.
child relationship. Everything I will comment. I make a file. I will
Mm-hmm.
involve my senior and the child protection team involved,
Mm-hmm.
and after that I will admit this child and I will ensure the other children's at home their safety.
Mm-hmm.
Then
Mm-hmm.
I will investigation.
Mm-hmm.
Investigation I will do. Full blood count I will do. Is there anemia or present or not? Renal function test, iron profile, and
Mm-hmm.
also I will do like bone profile, serum calcium, potassium, vitamin D, alkaline phosphate, erythroid hormone,
Mm-hmm.
genetic testing. Is there any genetic cause or not? uh, then
Mm-hmm.
I can do like celiac screening can we do. Then X-ray of the wrist I will do such rickets, and CT of the brain I can do as child is less than 1 year head injury.
Mm-hmm.
These are everything such. Then I will treatment multidisciplinary team involve my pediatrician consultant, child protection team.
Mm-hmm.
Then dietitian of course I will involve here. Social service,
Mm-hmm.
um, psychological
Mm-hmm.
support. These are I will give, ensure other child, and given
Mm-hmm.
if vitamin D actually, then we'll diet modification. Dietitian will do the diet modifications according to balanced diet, and
Mm-hmm.
vitamin D supplementation I will give, and
Mm-hmm.
I will sunlight, proper sunlight exposing the child. These are,
Mm-hmm.
and if any AI, the social service involved. These are
Mm-hmm.
my management.
So, okay, if your child, if you suppose if your child is like Ricket, so
Mm.
what you specifically looking for?
Vitamin D level I look it.
You look for vitamin D level. So,
Mm.
what do you know about and how it will be when the baby on your clinical assessment on clinical examination? What you may find if it is going in the favor of Ricket?
So wrist joint swelling,
Mm-hmm.
then ankle joint swelling, bowing of the leg, frontal bossing, rachitic rosary, pigeon shaped chest, pot belly abdomen, poor dentition, child will be irritable, crying. These are.
So, doctor, swelling of the wrist bone, what do you think in the if while if you can specify which bone is you think like it is giving the appearance of the widening? What is the
Because
meaning?
meaning the bones are fragile, there is uh,
Which part of
this
the bone what part of the bone which is
epiphyseal end.
epiphyseal bone is wide? Okay.
Hmm.
If you okay in the X-ray, what you will find in the X-ray?
So if say widening, coughing, widening of the facial bone, decrease the bone density, fraying, coughing, increased joint space and green stick fracture.
Mm-hmm. Okay, and if you said already that there is a bonus of specification would be light, so what you like to see in the labs? In the labs, what you want like to see in the labs?
So left, so I tell you bone profile, I will do urea and electrolyte, renal function test, because renal cause can be renal rickets. ABG we can do. These are iron
Okay,
profile.
so so you said it is bone profile. Bone profile means what you especially want, which may indicate you to think of ricket.
Serum calcium level, phosphate level, vitamin D, alkaline phosphate, and parathyroid hormone. Mostly it is nutritional rickets. I find
Mm-hmm.
vitamin D deficiency rickets.
So, if the child, what would be, do you think the parathyroid thyroid hormone level would be in such if it is nutritional ricket?
Thyroid hormone,
Parathyroid hormone.
parathyroid hormone will be very high in
Okay.
severe nutritional vitamin deficiency.
Okay. If you like to do besides X-ray, you mentioned already. You said me already the skeletal survey. Do you like to make any other radiological radiology?
Extra of the knee joint also you can do na. Ankle joint,
Mhm.
knee joint, chest X-ray also if needed do, because all there is bone changing.
Okay.
The
Would you
main
like to
thing,
do the DEXA scan or not?
yeah, DEXA scan we do because bone
Mhm.
is there any, why we do the DEXA scan?
Yeah, it is the
NAI
question I'm
also.
asking. Why?
I
Do
don't
you think
know.
it is needed or not needed? Tell me.
Yeah, DEXA scan we can do because NAI child abuse is our one of the DD and mother is really here. She
So
doesn't know anything.
if you're thinking the DEXA is related with the NII, so what it will give you the impression in the DEXA scan?
Different bone healing.
Uh-huh.
Am I right?
No, you're absolutely wrong. Wrong information.
So tell
DEXA
me what is
scan
DEXA scan? I don't know.
DEXA scan give the bone density. Remember.
Oh, sorry. DEXA scan bone density. Okay, I'm writing
And it
this.
is having no relation with NAI. Okay. Okay. Suppose like you said already NAI. So in the case of NAI, what are the markers which you think to do specifying and to make or narrow down that it is NAI?
So for NAI, first of full blood count we do, right?
What you will look in the full blood count.
Anemia, infection
Mm-hmm.
sign can be present. Child normal
Okay.
looking, like child clothing,
Hmm.
dirty, like that.
So would it
Child
help
won't
you
play.
in help you to identify NAI
From which?
full blood count?
Full blood count NAI? No. Full blood count
So
how
what is
can?
the okay? What the next?
Next, we can do the X-ray because we find the X-ray there are
Okay.
different
Then after the
bruising,
X-ray, after the X-ray.
healing,
Okay, after the
X-ray
X-ray.
investigation. You want to know, na?
Yes. While you
Mm.
are thinking, suppose if it is you're saying it is like NAI, so what you would like to do? X-ray. Okay, you
So that
mentioned. Okay,
mm,
you told me the full blood count. Okay, what else?
brain CT scan of the brain, MRI brain because of any shaking, any bleeding inside. So it can I do.
Okay. Okay. In this condition, in this age, would you think to make the CT scan brain? Okay.
Mm.
Okay. Go
Less
ahead.
than
Go
one
ahead.
year.
Okay. Okay. Go ahead. Next. Next. What else you will do?
Urine test we can do.
What is indicate you for regarding an AI?
Sometimes it's a male child, so not native. Sometimes sexual abuse actually UTI this develop a problem in an eye, something present.
And in the urine analysis, you thinking that it may give you the impression of the UTI, which going to think of an AI. Okay. Next.
Mm.
And
Next,
you
next what? Next, I don't know. You have not given me the homework. Then I will do that.
okay, that is the why I want to. This is the brainstorming. I am trying to bring your to think of like if you think you already mentioned, but I am trying to re-memorize you. You would do you do the ophthalmology?
Yes, fundus eye examination. Is there any retinal hemorrhage present or not?
Okay. Would you do the coagulation profile?
Coagulation profile, yes, I do. Is there any bleeding disorder? Yes, that's also, of
Hmm.
course, I do.
Okay. Okay. So, okay, come back to now rickets, as our topic is the rickets. So, in this case, what you the advice you will give to the mother?
But first of all, taking care the child.
Taking care in term
Second,
of what?
properly take care of the child.
Hmm.
Then
Means what?
number one, number two, social service I will involve.
No, I am asking about your advice.
Advice is diet history very important. Nutritional history, balanced diet. I will involve the dietitian. He will make a chart that is needed.
No,
Then sun,
the
proper sun
advice
exposure.
is advise the doctor, the thing which you are telling to the mother that to take care of the condition these things. So what the specific advice you think in this baby who came to you, they came to you with third time fracture, what
So
the specific about?
diet
Hmm?
advice I will give. First of all, diet
Okay,
advice I
okay,
will involve
okay,
dietitian.
one
They need to change. Number two,
one
look, sun exposure. The room will be
two
well
three
ventilated so
good.
that sun
Okay,
can.
two and
These, this
and
and also for a gait, anything we do, any therapy you give. I don't know.
mhm. Can you avoid trauma and minimal
Yeah.
handling?
Yes, avoid trauma, minimal handling.
Okay. And okay, now back to your topic, rickets. How many type of rickets you do you know?
So these are nutritional rickets,
Mm,
then drug-induced rickets like anticonvulsant,
okay,
hypophosphatemic rickets, any
okay.
chronic conditions like renal failure, liver disease,
Mm,
vitamin D resistant rickets.
hmm. So if I ask you, you said it is type 1, if it is like type 1 rickets, vitamin D dependent rickets. So what do you think of how you make a difference from the nutritional ricket?
From history first.
What you would like to take the history?
So history, the diet history I will take first. Sun exposure
Okay,
present or not. Family dynamics.
okay,
These are
okay. You already taken. Now I'm bringing you toward the laboratory investigation, lab value. Type 1
level.
dependent. What you will find in that important thing you like to mention?
Vitamin D deficiency, I find severe nutritional deficiency. Calcium will be low.
Oh,
Parathyroid hormone will be very high. Phosphate
mm-hmm,
low. Creatinine normal 25 D3. That is very low. And one to
mm-hmm,
find dihydroxy that is also low. And resistant rickets, what we find? Resistant also find calcium low, parathyroid high, phosphate low, but creatinine normal. Uh, 25
mm-hmm,
OH D3 is normal. 1 to
mm-hmm,
5 OH2 D3 is very high.
mm-hmm. Okay, doctor, I will tell you some about the type. There are nine types. Okay, remember, nine types of the
Hmm.
rickets are there. One is you
Hmm.
said already nutrition ricket. Okay, and there it is obvious vitamin D is deficient, so it is quite clear, and the parathyroid hormone will be quite high.
Hmm.
The important that the type 1 is rickets where type 1 when this cholesterol which is coming uh, it is a cholesterol derivative which is converted into the 25 hydroxy calcidiol in the liver, and then from
Okay.
there it converted into the kidney into 125 hydroxy calcitriol. So the problem what happened in type 1 dependent ricket, this 25 hydroxylase enzyme in the liver, they remain unable to convert the 25 into 125 because if it is not converted into the calcidiol, so it will not be available for the kidney to trans to convert it calcidiol into calcitriol. So what happened in type 1 rickets? The problem is the 25 hydroxylase is not there. So again, the similar finding of like a nutrition ricket, but only the difference would be that beside parathyroid hormone will be very high, but calcitriol would be also very low. Okay, you get my point?
Okay.
But in type 2 ricket, what happened? The air, the even the calcitriol is also very everything is there, but the problem is the receptors. So what happened? End organ resistance. So calcitriol is also high, parathyroid hormone is also high, but even then the calcium remaining low. In all this condition, the parathyroid hormone will be on the higher side. Okay, in
Hmm.
the case of chronic, in the fourth reason is the chronic renal failure, where what happened? This one hydroxylase
Okay.
enzyme which is there in the kidney, which is not there because of the kidney failure. In that condition, 25 hydrocalcidiol is 25 hydroxycalcidiol is remain unable to convert it into 125, that is calcitriol. So what happens due to its defective kidney also remain unable to excrete the phosphate. So in that condition, you will find the beside parathyroid also high, but here the phosphate will be also high phosphate level. And
Okay.
calcitriol vitamin D3 would be low. Fifth type, hypoparathyroid, where itself parathyroid is very low. And sixth type, X-linked hypophosphatemic ricket. In this condition, there is some gene mutation happens, where the proximal renal tubules cause the phosphate to get wasted. So because of the phosphate is too much splitting into the kidney, and so this is also one of the reasons which produce the X-linked hypophosphatemic ricket. The seventh type is the pseudo hypoparathyroidism, whereas the parathyroid hormone is resistance developed. Eighth type is the
Okay.
Fanconi type. Nine type is the Sanjak Sakati. So there are nine types. Remember. Okay, I think that's all.
You send me the sheet. If you have any note, you send me because the type I will write. So
Yeah, yeah.
today is, so I
I will
think
say.
if our discussion off, then you can off the recording.